Preterm births are on the rise again. 10% of babies born are premature. That's for the fourth consecutive year. The March of Dimes gave the United States a C on its annual report card. Dr. Thomas Lancaster, board-certified neonatologist with HCA Midwest Health, joins us this afternoon and has some good news for parents in this area. So, Dr. Lancaster, what are some of the primary reasons for the preterm birth rates to continue to rise?
About 14% of moms who are African American will have a preterm birth. When compared to white women, it's about 50% less. So there's significant racial and ethnic disparity when it comes to the rates of preterm birth. The primary reason for these preterm birth trends are lack of access to healthcare, especially in underserved areas and rural areas. So moms and their unborn babies are at a disadvantage when it comes to access to care and ability for education and potential resources that other places in the United States and other populations are able to access.
You kind of ran through some of the reasons as to why preterm birth is an issue for some women. What advice do you have for those parents?
Well, the first thing is to ensure that you get prenatal care. And one of the major reasons we're seeing a rise is concerns for additional health problems. So chronic health issues such as high blood pressure, diabetes, depression, thyroid issues, those certainly can make a pregnant woman have a higher chance of having a preterm birth. So by addressing those health concerns, you might be able to lower your risk of having a premature baby.
And you also say that you have some exciting news. What is that for new resources as it relates to premature births?
Well, I appreciate you asking, Kelly. We have exciting news to report for our community. We have just opened up our small baby unit at Overland Park Regional Medical Center, which is our highest level of NICU in our county. We specifically wanted to address the concerns about babies born less than 30 weeks and how they do long term. So we opened up the small baby unit, which is named Mighty Meadow, and it's specific for babies less than 30 weeks. So now we can ensure that we have a very special place for these babies that are deemed micropreemies. So again, babies less than 30 weeks. And the goal of this specialized unit is to take special care of the tiny baby and the parents.
Very quickly, last question for you. What can women who are pregnant or planning to become pregnant do to lessen those chances of delivering early?
Excellent question, and I think a very important one. Make sure that you go to all prenatal care appointments. Ensure that you get access early in the pregnancy to medications or to treatments for chronic health conditions. Again, like high blood pressure, diabetes, depression, those sorts of things. Try to get to a healthy weight prior to getting pregnant and gain the right amount of weight during pregnancy. Protect yourself from infections. Try to keep up to date on immunizations. Wash your hands, of course. We've been doing that religiously now for over a year, but I think it's especially important when you're pregnant. Avoid raw meats, fish or eggs. And then overall lifestyle keys include eating healthy, exercising, not smoking, not drinking alcohol, or doing drugs while pregnant. I think all these factors can lead to the best possible outcome when it comes to a pregnancy, and try to avoid coming to see me in the NICU.
All right, sounds good. Thank you so much, Dr. Lancaster. We do appreciate you coming on the show today.